Hello, assalamu alaikum. This is me, Dr. Jahangir, and you're watching me on my YouTube channel, that is Dr. Jahangir Khan. This is a very important X-ray. You can see this patient presented with the chief complaints of shortness of breath. That is more on exertion. The patient is having ascites, and the patient is having tender hepatomegaly and bilateral period edema. Now, what do you see in this chest X-ray? The most prominent sign in this chest X-ray is you can see over here this thing. You would not see this thing in a normal X-ray, and you cannot see this thing, this prominence over here in a normal chest X-ray. Now, when you see a normal chest X-ray, you are having aorta coming down, and then you appreciate the pulmonary trunk over here. So you can see a small depression on the chest X-ray. This depression is called pulmonary bay. Over here, this depression is obliterated by this thing. This is called positive pulmonary bay sign. This is called positive pulmonary bay sign, and the pulmonary bay is obliterated by this opacity. Now, what is this opacity? Normally, you can appreciate the aorta behind. This is the aortic line, and this actually over here is pulmonary trunk. So normally there is a concavity. When you see a normal chest X-ray, there is a concavity. So in this X-ray, the concavity is lost, and that is replaced by an opacity. And also, if you see over here, that is also the size of that is increased. This is called pulmonary arterial hypertension. This is a case of pulmonary hypertension, pulmonary arterial hypertension. The pulmonary trunk is dilated, and the descending pulmonary artery on the right side is dilated. So if you see pulmonary bay sign, this it means pulmonary arterial hypertension. Now, that may be due to any cause. That may be primary or idiopathic pulmonary hypertension, may be secondary, may have 5 WHO classes. We will discuss in the next lecture the algorithm for pulmonary hypertension. But right now, you just focus on this chest X-ray with a positive pulmonary bay sign, and this is called pulmonary arterial hypertension. So pulmonary bay sign, this is a very important sign. You can miss this, but you should not miss this. This is a prominent pulmonary artery. We know that in the right hilum we are having arteries, veins, nerves, lymph nodes. But when you see pulmonary bay sign and along with that the bulky right hilum, this is actually a descending pulmonary artery. Thanks for watching. Do subscribe my channel and press the bell icon so that you can get notification of my new video. What is the best next step? Answer is echo with PAP, pulmonary arterial hypertension. That will show you PAP, pulmonary arterial pressure. Then for the etiology of PAP, what is the best next step? Look for ejection fraction, point number 1. Point number 2, look for pulmonary embolism and lung parenchyma. So you do chest HRCT, and then you do a VQ scan to exclude recurrent pulmonary embolism. Look for obstructive sleep apnea, obesity, hypoventilation syndrome. These are the causes for this case. Thanks for watching.